COVID-19 is a viral disease that can affect the lungs and respiratory tract. Symptoms of COVID-19 can be mild or severe. They can include fever or chills, cough, breathing problems, such as shortness of breath or tightness in your chest, weakness, feeling very tired or tired, muscle pain or body pain, headache, loss of taste and smell, sore throat, nasal congestion or runny nose, nausea, feeling of impending vomiting or vomiting, diarrhea, loose or watery stools. You may first notice symptoms 2 to 14 days after contracting the virus. They can last for 1 to 3 weeks. Typically, cancer patients have the same symptoms as other people. Some people with COVID-19 may not show symptoms, i.e., the disease goes away without symptoms. Even if you have no symptoms, you can still spread the virus and infect others. Many people may have a cough for several weeks after having a viral illness, such as COVID-19. If the cough does not get worse or, conversely, weakens, then there is no cause for concern. Try to cough into a bent elbow or cover your mouth and nose with a tissue. If your cough gets worse, or the phlegm, mucus you cough up, has blood that hasn't happened before, or if you cough more phlegm, call your healthcare provider. Currently, 2 types of tests are used to diagnose COVID-19. Polymerase chain reaction, PCR, also called a molecular test. PCR tests are very accurate, but it can take several days to get results. Rapid test for antibodies. It usually takes less than an hour to get your rapid test results. However, rapid tests are more likely to be falsely negative than PCR tests. This means that rapid tests are more likely to show the absence of COVID-19 if the disease is actually present. If you have symptoms of COVID-19 and the rapid test result is negative, it is best to have a PCR test to be sure. With both types of tests, you get either positive or negative results. A positive test means you are sick with COVID-19. A negative result means you are not sick with COVID-19. Keep a daily journal of your symptoms and the medications you take to correct them. This will help you see how your symptoms change over time. This can be useful if you need to see your healthcare provider or come to an appointment. If you are using a sleep apnea prophylaxis device, such as a CPAP machine or a home nebulizer, consult your healthcare professional before using them. Such devices can spread the virus that causes COVID-19. For fever, body aches and headaches, you can take acetaminophen, Tylenol registered. Do not exceed 3 g of acetaminophen in a 24-hour period. Too much is bad for the liver. Acetaminophen is a very common ingredient in many OTC and prescription drugs. Always read the labels of the medications you are taking. Sometimes the full name of acetaminophen is not indicated on the label. For a list of common medicines containing acetaminophen and abbreviations for acetaminophen, see our resource Common Medicines containing aspirin and other nonsteroidal anti-inflammatory drugs, NSAIDs, or vitamin E. Over-the-counter cold medications won't speed up your recovery from COVID-19, but they can help you with a cough, sore throat, or nasal congestion. Do not take a decongestant if you have high blood pressure. Antibiotics will not speed up recovery from COVID-19. Do not take antibiotics unless your healthcare provider has prescribed them. If you are asymptomatic with COVID-19, do not take cold medications, acetaminophen, Tylenol registered, or over-the-counter nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Advil registered, and naproxen, Aleve registered. These drugs can mask the symptoms of COVID-19. You can take aspirin at a low dosage, 81 mg, mg, per day, after directed by your healthcare professional. If you think the dose needs to be increased, contact your healthcare provider. Measure the temperature every day 2 times a day in the morning and in the evening. If you are on chemotherapy and have a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher, call your healthcare provider. If your temperature is 102 degrees Fahrenheit 38.9 degrees Celsius or higher persists for 24 hours and does not improve after taking acetaminophen, call your healthcare provider. The food should be light. For example, instead of 3, eat main meals 6 times a day in small portions. This will help relieve nausea and reduce appetite loss. Drink 8 to 10 glasses, 8 ounces, 240 milliliters, of liquid every day. This will help you prevent dehydration and help clear mucus from your nose and lungs. Water, sports drinks, decaffeinated fizzy drinks, juices, tea, and soup will do. How to prevent the spread of COVID-19. COVID-19 spreads easily from one person to another. It can spread by airborne droplets or remain on surfaces after a sick person has coughed or sneezed on them. In addition, it can be transmitted when someone comes into contact with a sick person and then touches the eyes, nose, or mouth. If you develop symptoms of COVID-19, but the test results are not yet known, follow these instructions until don't get your test result and it will be negative. If you have taken a rapid test and the result is negative, check it with a PCR test. Continue following these instructions until you get a negative PCR test result. If you do not have symptoms of COVID-19, but test results are not yet known, follow these instructions until don't get your test result and it will be negative. If you have been diagnosed with COVID-19 and have symptoms, follow these instructions until at least 3 days have passed since the last fever above 100. 4 degrees Fahrenheit 38 degrees Celsius, without taking an antipyretic medication such as acetaminophen, Tylenol registered, ibuprofen, Advil registered, naproxen, Aleve registered, aspirin in large doses, more than 81 mg per day, or indomethacin, Tiverbex registered, your breathing will not become easier, or your breathing will not return to normal. Do not receive a negative PCR test result at least 10 days after the first positive test result, or until at least 4 weeks have passed since the first positive COVID-19 test result. If you have been diagnosed with COVID-19 but have no symptoms, follow these instructions until do not get a negative PCR test result at least 10 days after the first positive test result, or until at least 4 weeks have passed since the first positive COVID-19 test result in the absence of symptoms. If symptoms of COVID-19 recur, immediately resume following these instructions and call your healthcare provider. Stay home unless medical attention is needed. Refrain from activities outside the home other than those involving medical attention. Do not go to work, school, or other public places. Refrain from using public transport and do not use ride-sharing or taxi services. If you need to go out, wear a mask that covers your nose and mouth whenever possible. If you need medical attention, call your healthcare provider first and notify them of your visit. Isolate from the rest of the household. Choose your own room in the house. If possible, try to stay in this room away from households and pets. Use a private bathroom, if available. At least once a day, clean and disinfect surfaces you touch frequently, such as phones, remote controls, doorknobs, plumbing fixtures, toilets, keyboards, tablets, kitchen worktops, tabletops, and bedside tables. If the surface is dirty, use soap and water or a household cleaning spray or wipes. Then treat it with a disinfectant. Follow label directions. Don't let anyone visit you. If you need to be close to other household members or pets at home, if possible, try not to get closer than 6 feet to them. Wear a mask if possible. Open windows and turn on a fan to keep air moving. Caregiver selection. If you need help, decide which family member will look after you. Your caregiver must be in good health. He must not have chronic, long-term illnesses, and his immune system must not be weakened. It is best if you are cared for by someone who has completed the full course of COVID-19 vaccination. Cover your nose and mouth with a mask if you need to be around other people or pets, even at home. You do not need to wear a mask when you are alone. Do not wear a mask if it causes you breathing problems, or if you cannot yourself take off the mask carefully. Cover your mouth when coughing and sneezing. Cover your mouth and nose with a tissue when you cough or sneeze. Place the used cloth in a trash can with a trash bag or lid. If you cough or sneeze, wash your hands right away. If you wash your hands with soap, wet and lather. Rub thoroughly for at least 20 seconds, then rinse. Dry your hands with a paper towel and close the tap with the same towel. If you don't have paper towels, you can use clean terry towels. Change them when they get wet. When using an alcohol-based hand rub, Be sure to apply it all over your hands. Rub your hands together until it dries completely. Refrain from sharing personal household items. Do not share dishes, glasses, cups, cutlery, towels, or bedding with other household members or pets. Thoroughly wash dishes, glasses, cups and cutlery with soap and water, or use a dishwasher. Store dirty laundry in a laundry bag. Do not shake dirty laundry. Wash it with regular laundry soap at the highest temperature possible. Dry thoroughly. To come back to the beginning tips to help manage stress, it's okay to worry about COVID-19, especially if you or someone you love is sick. To keep your peace of mind, you can communicate with a friend or loved one by phone or video chat, learn a new hobby, or start doing something for which there was usually not enough time. Take a break from the news. MSK has many professionals, volunteers, and support programs to help you cope during this period. For more information and other tips on how to deal with stress, read our resource Managing Stress and Anxiety Around COVID-19. When to contact your healthcare provider. Call your healthcare provider right away if you have trouble breathing at rest, you have difficulty breathing when walking short distances. An example of walking short distances would be walking about 25 feet from one room to another. You are on chemotherapy and have a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. You have a fever of 102 degrees Fahrenheit 38. 9 degrees Celsius or higher for 24 hours and does not get better after taking acetaminophen. You have blood in your sputum. You are experiencing chest pain. You have a severe headache. You have questions or concerns.